And welcome back to The Big Picture. 2 years after a government shutdown cost the American economy billions and billions of dollars, our nation's capital is once again hurtling toward, you guessed it, a government shutdown. And once again, the issue at stake is health care. In this case, women's health care. Current funding for the government is set to expire on October 1st, next Thursday. But 31 Republican members of Congress have said they will refuse to vote for new funding bills unless they defund Planned Parenthood. On Friday, the House did pass a separate bill to strip the group of all of its federal funding for 1 year. But even that may not be enough to satisfy the hardcore conservatives who have made destroying an organization that's mostly devoted to cancer screening their #1 goal. And that last point raises a really important question. Just what would America look like if Congress did manage to defund Planned Parenthood? Let's ask Emily Crockett, federal policy reporter at RH Reality Check, rhrealitycheck.org. Emily, welcome.
Thanks. Glad to be here.
Yeah. So the federal government's banned from funding abortions, and since 97% of their services are devoted to cancer screening, STD services, reproductive health, contraception. Mm-hmm. Who loses if the Republicans succeed in defunding Planned Parenthood?
Well, women lose, and especially low-income women specifically lose out. Planned Parenthood is the leading reproductive health care provider specifically for low-income women. About 4 to 5 of their patients are low-income, less than 150% of the poverty line. And so they provide, yes, STD screenings, cancer screenings, breast cancer or breast exams, but also abortions. And abortion care is also important medical care for women. We say that it's only 3% of those services, but it is still a significant 3%. Now, the problem with defunding Planned Parenthood is, well, there are many problems with it. The Republicans know that it's a trusted health care provider. They know that Democrats will say over and over again till they're blue in the face, Planned Parenthood serves almost 3 million people a year. 1 in 5 American women will at some point in her life go to Planned Parenthood. It's mostly low-income people who rely on Planned Parenthood for their health care. So what they've started saying is that, well, we'll take this Planned Parenthood funding and instead we'll give it to other healthcare clinics. And the same people, the Republicans, who are trying to defund the Title X family planning program for low-income people are now suddenly singing its praises because it's not Planned Parenthood. Now, of course, the reason they've been trying to defund Title X is to get at Planned Parenthood indirectly. But the fact remains that they are trying to say that community health centers, many of which are funded by Title X, and many of which are already overburdened. For every 3 people who need services, only about 1 are actually getting them right now in this system. So Republicans are trying to say that these already overburdened providers are somehow going to be able to take on a huge patient load, sometimes
3 million people.
Hundreds of % more, depending on where you are.
Yeah.
In 1 out of 5 of the counties that Planned Parenthood has a clinic in, they are the only safety net family planning center available.
And this has got to be exacerbated by the fact that Republican governors and legislatures in red states have refused to expand Medicaid.
Yes.
So women who are already in poverty, I mean, literally have no health insurance. They have no access to health care outside of the ER.
Yeah, exactly. Yes, and now the thing about Republican governors who are trying to defund Planned Parenthood is that defunding Planned Parenthood is actually easier said than done to a certain extent, partly because a lot of its government funding, both state and federal, comes from in the form of Medicaid reimbursements. And this is mandatory spending that you can't necessarily just sort of lop off just willy-nilly. And there's actually, so Bobby Jindal, for instance, is now defending himself in a lawsuit where the Department of Justice has taken Planned Parenthood's side, saying that you can't do this because Medicaid law guarantees that you cannot cut off a Medicaid provider just because they provide abortion services. So unless there's like a good reason that disqualifies them as a healthcare provider, not just that the governor doesn't like their agenda, that you cannot you can't take away a patient's choice of provider.
But at the same time, even though that money is running through, none of it is funding abortion. The Hyde Amendment, which was passed in '76 in the the wake of Roe v. Wade and the hysteria around Roe v. Wade, has been very, very effective all these years at preventing any federal funds from going to any abortion activity. How crazy is it that the Republicans are saying the law we passed in 1976 has been working perfectly, apparently isn't strong enough because we've got to unfund the abortions that we're not funding? I mean, I don't, in the minute we have left, can you make any sense out of that logic, or is this just campaign rhetoric?
So, well, it's crazy. What they're trying to say is that because if we fund other women's health services and we are somehow helping Planned Parenthood keep its lights on, and so we're helping them do abortions even though we're not directly funding them. Now, this is completely absurd. If that were the case, the government would never be allowed to fund secular services that are done through religious organizations. And if that were true, it's just an absolutely absurd argument. Nonetheless, they're trying to make it. They're trying to say that, and also their argument assumes that if you take away all of Planned Parenthood's federal funding, then they will somehow magically decide that, oh, well, we should just get rid of our abortion care in order to save costs. That's not what Planned Parenthood's going to do. They might cut costs in other ways. It's going to hurt them. It's going to hurt low-income women. Right. As many as 600,000 women may not have necessary medical care as a result of this if Planned Parenthood shut down. Nonetheless, yeah, it's
very bad news.
Yep, definitely
Emily,
bad news.
Thanks so much for coming on.
Thank you.
It's great
Good to be here.
Thank you.